Welcome everybody. This webinar will talk about the request for proposal, application process, and materials for the ACORNS and CITE Phase 2 funding for 2018-2019. In today's webinar, we'll talk about the different programs, including the Good Health and Wellness in Indian Country, or GWIC, Advancing Opportunities to Renew Native Health Systems, ACORNS, and the California Indian Tobacco Education Program, or CITE. We will discuss different Phase 2 project activities for ACORNS and CITE, the funding eligibility. We'll talk about important dates, what is the available funding for this project year, what are the project requirements, budget guidelines and allowable expenses. We'll discuss application guidelines, and finally we'll talk about the available training and technical assistance for this application process. So as an overview, Good Health and Wellness in Indian Country, or GWIC, is a 5-year grant that was awarded to CRIB by the Centers for Disease Control and Prevention, or CDC. CRIB has called this funding ACORNS and also CITE, as we'll see later. The overall project objective of GWIC is to implement tribally driven, effective policies, systems, and environmental improvements to prevent and manage chronic disease in tribal communities. Some of the ways in which we try to accomplish that objective is by designing projects that decrease commercial tobacco use and exposure, increase opportunities for physical activity, increase access to and consumption of healthy foods and beverages, strengthen community clinical linkages and team-based care, and increase support for breastfeeding. So as part of that GWIC funding, we have the Advancing Opportunities to Renew Native Health Systems, or ACORNS. ACORNS was a 2-phase project. The first phase, which happened in the first 2 years, was the community health assessment. This is where funds were allocated for tribes to conduct a community health assessment and then develop a community action plan based off the results of that assessment. The Phase 2 part of ACORNS, which is what this funding opportunity is for, is focused on program implementation. This funding is going to be used to implement those community-chosen and culturally adapted policies, systems, and environmental changes to address commercial tobacco use, access healthful nutrition, physical activity, and strengthen team-based care and clinical community linkages. So we'll be using the community health assessment and action plan that was created in Phase 1 and implementing that in Phase 2. The California Indian Tobacco Education, or our CITE program, is additional funding that CRIB received through GWIC funds to focus on funding tribes and tribal organizations working specifically to reduce the use and exposure to commercial tobacco. CITE has 4 major program strategies. These are the main strategies that you will use to guide the project application and your proposed work plans. The 4 strategies include: 1, expand the reach of the CDC TIPS media campaign or other federal tobacco education campaigns, Surgeon General reports, and other tobacco-related science or evidence-based publications among tribal members. 2, inform tribal leaders, decision makers, and tribal communities about the burden of commercial tobacco use to their tribal members and tribal economy. 3, implement evidence-based, culturally relevant interventions that increase the number of American Indian and Alaska Natives protected from secondhand commercial tobacco smoke as a result of implementing commercial tobacco-free policies. And 4, implement evidence-based, culturally appropriate tribal interventions that decrease AIAN exposure to commercial tobacco marketing and the availability of commercial tobacco products. Some different project activities for CITE and ACORNS. If you're working in nutrition, an example is to establish a community garden that increases access to healthy food. An example of physical activity project would be to maintain a network of walking routes and nature trails. If working into commercial tobacco, an example could be implement a smoke-free policy 24/7 for outdoor public places. Another example for commercial tobacco is educate the community on the impacts of commercial tobacco use and exposure on health and the economy, or also educate on the difference between commercial and traditional tobacco. Those are examples that can also be used as a CITE proposed project. If working in breastfeeding, An example might be to designate a breastfeeding room at the workplace and update organizational policies to promote its use. And for clinical community linkages, an example is update health center policies or procedures to include strategies that improve patient outcomes like referrals to preventative services, case management, and or increased communication between the medical staff. All of these examples use those policy systems and environmental or PSC strategies that are required of this program. If you want more examples or ideas about how to incorporate PSC strategies in your work plan, please contact program staff and we'd be happy to discuss that with you. So what is the eligibility requirements for this funding? This is the eligibility requirements for both CITE and ACORNS. First, you must be a California tribe or tribal organization supported by a federally recognized tribe within the state of California and have completed phase 1 deliverables, which include the community health assessment and community action plan, and have sufficient capacity and resources to complete the proposed project activities within the project timeframe. Additionally, if you are a tribe that's within the UIHS or United Indian Health Service service area, unfortunately, you are not eligible to apply for CRIB GWIC funds because UIHS was also awarded a GWIC award, and so you would fall under their services. If you are interested in being a part of GWIC funds, please contact Valerie Reed at UIHS and she'll be able to connect you with that. Some important dates for this RFP and application process. The first one is August 3rd, 2018 is when the RFP will be released. The applications are due Tuesday, September 4th, 2018 by 11:59 p.m. PST. Notifications of funding or notifications of awards will be released October 12th, 2018. And then the project period will begin November 12th, 2018 and end September 29th, 2019, meaning all of your proposed project activities need to be completed within this project period. And then finally, the application technical assistance will be available beginning August 3rd and up until applications are due. So what available funding do we have? We have the approximate number of awards will be about 20. A one-year award amount can range from $5,000 to $25,000. You are able to request an award amount between that range, and then the amount of awards will be based off of that. This is a competitive funding opportunity. So programs will be awarded based on an application review, and they're going to be reviewed based off the following criteria. First, the degree to which your proposal meets all RFP requirements. So please read the RFP announcement thoroughly and ensure that you are submitting an application that follows all of those guidelines. And two, the feasibility of achieving project objectives within the estimated schedule and budget. So is the proposal look possible and feasible, and does it fall within that, and do we think that what you have proposed can be accomplished within the year? So what are the project requirements? Very importantly, first, identify leadership and staff support, ensuring that the people that will be involved in the project and supporting the project are on board and understand their requirements. Number two, complete the activities indicated in the grantee proposed work plan. Meaning, so if you're writing a work plan and proposing it with your application, that part of the subcontract agreement is that you will complete all of those proposed activities within that time, within this project timeframe. Three, adhere to all reporting requirements. There will be progress reports and final reports. Four, work collaboratively with the California Tribal Epidemiology Center. Five, participate in at least one site visit before September 29th, 2019. Six, participate in a project-sponsored meetings and trainings. And lastly, commit to the requirements of the subcontract program, including adhering to timelines and providing the appropriate deliverables. So please note that that should be September 29th, 2019 that you must complete your site visit. So what are the budget guidelines? We do require that you submit a budget with your application, and you will need to provide detail and justification on how each of the items below is needed to accomplish your proposed project. That will include salary and wages, fringe benefits, travel, consultant services, and supplies. If you do need to add other categories, that is allowed. You will just also need to provide detail and justification for those categories. So what are some allowable expenses? Some examples of allowable expenses include, but are not limited to, signage, supplies, computers and software, printing costs, purchasing food for cooking demonstrations, providing a reasonable stipend for coalition members, supplies for the establishment or purchase and or upkeep of a greenhouse, garden, hoop house, and hiring of outside experts for training and technical assistance. Grant funds may not be used for clinical services, purchasing furniture or equipment. Equipment is something that's worth more than $5,000 per unit and has a lifetime of over a year. No construction or renovation of facilities, no lobbying, no purchasing of livestock, and no paying for travel unrelated to the project. This is not an exhaustive list, so if you have additional specific questions pertaining to allowable expenses or funding limitations, please contact program staff. Okay, so what are the application guidelines? So the application will be submitting 3 parts. There's the application, there's attachment A and attachment B. The application includes the cover page, the problem statement, describing organizational capacity, your evaluation methods, your budget, and your authorized signature. Work plan is the attachment A. That's where you'll be outlining your project objectives and activities in the work plan attachment. And then the third piece is the outcomes and evaluation plan, which is attachment B. So all 3 of those things must be submitted, and they include those bullets. So how do you submit your applications? If you are applying for the ACORNS program, you will be sending it to Geneva Sorensen at jsorensen@crib.org. If you are applying for the CITE program, you will be submitting your applications to Monica Martin at mmartin@crib.org. For either one of those projects, please write in the subject line of your email, proposal for ACORN subcontract from, and then include the name of your agency, and the same would go for CITE. Again, applications for both projects are going to be due on Tuesday, September 4th, 2018, no later than 11:59 p.m. PST. So, and all of the information for this is for both programs. So the application materials are going to be very similar, and some of the requirements as discussed. So application technical assistance. Because this is a competitive funding application and process, we want you to be able to submit competitive applications. So we are providing a lot of opportunities for training and technical assistance associated with your application. As an eligible tribal organization for phase 2, you should have received some emails from Julie Villa, which had included an attachment for a TA request form. If you haven't received that, please contact program staff. You can also find that TA request form at crib.org/acorns. This request form may be filled out and returned to Julie Villa at jvilla@crib.org. Some of the examples of training and technical assistance that we will be providing include giving you sample application documents so you can see how to fill those out appropriately. There will also be separate recorded webinars for each of those 3 application components, the application, attachment A, and attachment B. Those are available to watch, where we go step by step through those documents and describe what's needed on each of them. There is also over-the-phone consultations to discuss specific project ideas in your application, where you can work with staff to really to develop your proposal. We are also offering early application feedback. If you would like to submit your application early and receive written or verbal feedback from program staff on ways to improve it and strengthen it, that is available. Please note you must submit that early application by Monday, August 27th. in order to allow us time to give you feedback and return it, and you be able to submit it on time on the 4th. Additionally, we're going to have weekly web-based question and answer sessions. They are going to be held August 8th, 15th, and 22nd. Those are Wednesdays from 11 to 12 p.m. And then finally, August 29th from 10 to 11 a.m. So please, we really highly recommend that you take advantage of the training and technical assistance that we're offering in order to make a competitive application. Again, if you have any questions about any of this or any of this application process, please contact program staff. We're happy to discuss this with you in more detail. Thank you for participating. This is my contact information, and we look forward to receiving your applications.